Type 1 diabetes mellitus versus the type 2 diabetes mellitus. Now comparing them, the type 1, there is according to etiology, it is autoimmune. Type 2, it is insulin resistance, and there is impaired insulin secretion. Age of onset in type 1 is in the young, and age of onset in type 2 is in adults. And look at the HLA association. It is by DR3 and DR4. In type 2, it is by there is no HLA association. Now looking at the body weight, in case of the type 1, it is normal or underweight, but in case of type 2, it is obese. Family history, it can be positive or negative in case of type 1. In type 2, it is highly positive. Presentation, it is abrupt in case of type 1. In case of type 2, it is gradual and symptomatic. Then looking at the insulin requirement. Insulin requirement is absolute in case of type 1. In type 2, it is oral, hypoglycemia, and later insulin. And looking at the serum inulin level and the C-peptide level, it is low in case of type 1, it is high in case of type 2. Then moving on to the clinical features. Clinical features in case of type 1, there is diabetic ketoacidosis. It is more common in type 1. It is associated with the autoimmune diseases. There is presence of Addison's as well as the rheumatic arthritis. There is Schmidt syndrome and the polyglandular failure syndrome. Then looking at type 2, there is a non-keto hyperosmolar, which is common here.